Hey, this is my, oh wait, this is my head to toe recording. This is the room. Nothing on the whiteboard and the table. Thing I'll do is provide patient privacy. Hello, my name is Isabella and I'll be your student nurse today.
Hi,
Perform hand hygiene and put on PPE if indicated. Can you verify your name and date of birth for me?
Ashley Colby, 0517-1997.
Okay, and do you have any allergies?
No.
Okay, so the first thing I'll do is provide education. So today I'm going to be performing a head to toe assessment. I'll be going through each body system, asking you a few questions about it, performing a few tests. So the first thing I'm going to have you do is remember 3 words, and I'll ask you to repeat them back to me later on in the assessment. So remember the words orange, candle, and backpack. So to start the general survey, I will assess the patient's consciousness. So the patient is conscious, alert, responding to my questions appropriately, and then I'll assess their orientation. So what year is it?
2025.
And what city are you in?
Mesa.
And how old are you?
25.
And what brought you in today?
Regular checkup.
Okay, so the patient is alert and oriented ×4. Then I'm going to assess the patient's overall posture, position, and facial expression. So the facial expressions are present, their posture is erect, and they're able to change positions independently. Then the next thing I'll do is assess the patient's mobility. So they have no mobility aids present at this time. There's no tubes, IV lines, machines hooked up to them, or any wound dressing. So the patient has unobstructed mobility. And then I will perform vital signs. So I'll start by doing blood pressure via the 2-step method. So I'll palpate the brachial artery until I no longer feel the pulse. I stop feeling the brachial pulse at about 120, so I'll let the arm rest for a minute. And then I will take the patient's heart rates and respirations at this time. Okay, so the patient's heart rate was 80 beats per minute. And it was +2 regular rhythm. And then the respirations were 18 breaths per minute. And then at this time, I would also perform the O2 saturation. So I would make sure the patient has no nail polish or acrylic nails, take their O2 sat and say I got 98% on room air. And then I would take their temperature as well. So I would take it orally and I got 98.5 degrees Fahrenheit. And then I'm going to do the second step of the blood pressure. So I'm going to auscultate the brachial artery. Okay, so the patient's blood pressure was 124/82. And then I'm going to assess for pain at this time. So are you experiencing any pain right now?
No.
Okay. Next I'm going to move on to head and neck. So I'm going to observe the head for the overall size, shape, and hair distribution. So the shape is round, no visible protrusions. Size is proportional to the body, and even hair distribution throughout. Then I'm going to palpate the head for any areas of tenderness and any lumps or bumps. Any tenderness?
No.
Any tenderness here?
No.
So patient reports no tenderness and there's no lumps or bumps on palpation. Then I'm going to assess the facial skin. So the facial skin has even coloring throughout, no wounds, no lesions, no visible inflammation, and there's no involuntary movement. Then I'm going to ask the patient to bite down for me. I'm palpating for contraction of the temporal and masseter muscles, and then go ahead and close your eyes and say here every time you hear you feel a touch.
Forehead. Forehead. Cheek. Other cheek.
Okay, so this demonstrates that cranial nerve 5, the trigeminal nerve, is intact. And then I'm going to palpate the thyroid at this time for thyroid enlargement. So there's no thyroid enlargement at this time. And then I'm going to assess the neck for the overall symmetry. So the symmetry is even on both sides. The trachea is midline, and there's no visible lumps of the neck either. And then I'm going to locate and palpate the lymph nodes. So I'll do the pre-auricular, any tenderness?
No.
Post-auricular?
No.
And occipital, any tenderness? No. Tonsillar?
No.
And submandibular?
No.
And submental?
No.
So no tenderness or inflammation in any of the lymph nodes. And then I'll assess spinal accessory nerve, cranial nerve 11, by having the patient turn their head against resistance, left and then right, and then shrug your shoulders. So the patient's cranial nerve 11 is intact. Then I will move on to the eyes. So I'll assess the eyelids for any drooping or sagging, so none of that is present at this time. And I'll assess the patient's sclera and conjunctiva. So the sclera is white, there's no signs of jaundice, and then I'm going to retract the lower lids. So the conjunctiva is pink and moist, no signs of petechiae. The irises are blue, and then I'm going to use my pen lights and assess for Perla. There's also no jaundice present in the eyes, so just look straight ahead for me. Okay. So the pupils are about 6 millimeters in size, and they were equal, round, and reactive to light and accommodation. So since Perla is present, that demonstrates that cranial nerve 2, optic nerve, and cranial nerve 3, oculomotor nerve, are both intact. Then I'm going to assess the 6 cardinal fields of gaze to check for eye alignment and extraocular movement. So do me a favor, just follow my finger. So since the patient was able to perform this test, that means that cranial nerve 4, the trochlear nerve, and cranial nerve 6, the abducens nerve, are both intact. Then I'm going to move on to the ear, nose, and throat. So I'm going to check the ears for their placement, shape, and any discharge. So they're aligned with the eyes, they're symmetrical on both sides. Using my pen light to visualize for any discharge. There's no discharge present at this time. And then I'm going to palpate the ears for any tenderness or inflammation. Any tenderness here?
No.
What about here?
No.
Okay, no tenderness or inflammation of the ears at this time. And then I'm going to stand behind the patient on each side and conduct the whisper test. So just repeat back whatever you hear. My favorite color is blue.
My favorite color is blue.
I like going to the beach.
I like going to the beach.
Okay, so patient was able to perform the whisper test, so their hearing is intact. Next, I'm going to assess the nose, the inner and outer nose. So the nose is straight, nostrils are equal, the septum is midline, so there's no presence of a deviated septum. I'm going to use my pen light to assess the inner nares. So the nares are patent, there's no discharge, no occlusions. And can you cover one nostril at a time and breathe through? Okay, so the patient has unobstructed breathing through their nose. There was no swelling or inflammation inside. And then at this time, I would test cranial nerve 1, the olfactory nerve, by giving them a scent to identify with their eyes closed, such as mint or coffee. If they were able to do this, that shows cranial nerve 1 is intact. Then I'm going to assess the mouth. So the lips are moist and there's no excessive dryness present. They're pink in color. And then I will ask the patient, do you use dentures?
No.
Do you use chewing tobacco or smoke?
No.
Okay. And then I'm gonna assess the inner mouth, so open your mouth. Okay, so the patient has no bleeding of the gums, no inflammation, no missing teeth, and no cavities. And then I'm gonna have you do it one more time. See what your tongue say Okay. So there I assessed the patient's tongue, throat, and tonsils. So the tonsils showed no sign of inflammation. The throat was unobstructed, no swelling. The tongue was pink and moist. There was no white patches, lesions, ulcers present in any area of the mouth. Then I'm going to assess cranial nerve, a few of the cranial nerves. So I'm going to assess cranial nerve 9. And cranial nerve 10. So 9 is the glossopharyngeal nerve, and cranial nerve 10 is the vagus nerve, by asking the patient, can you please swallow for me? So patient has swallowing ability, cranial nerves 9 and 10 are intact. And then I'm going to assess cranial nerve 12, the hypoglossal nerve, by having the patient touch their tongue to the insides of their cheek like this. Okay, and say light, tight dynamite.
Light, tight dynamite.
So cranial nerve 12 is intact. Then I'll move on to the respiratory portion of the assessment. So for the respiratory assessment, I would reverbalize what I got during vitals for respiratory rate, which was 18 breaths per minute. The patient's breathing pattern is regular and regular rhythm and regular pattern. They show no signs of respiratory distress, and they're not currently on oxygen, so they're breathing on room air. The next thing I'll do is ask them a couple questions about their respiratory history. Do you have a history of respiratory disease?
No.
And have you had cough recently?
No.
And have you had any trauma or surgery that would affect your breathing?
No.
Okay, perfect. Then the next thing I'm going to do is put my hands on the anterior and posterior chest to observe for equal expansion during breathing. So take a deep breath. And one more. So patient has equal chest expansion on the anterior and posterior side. Then I'm going to assess the anterior and posterior thorax for any abnormalities. So the patient is not barrel chested at this time. And then I'm going to auscultate all the lung fields. So there are 8 lung fields on the anterior side, 10 lung fields on the posterior side, and I will move in a zigzag pattern. So take a breath every time you feel the stethoscope move. And it would be best practice to perform this without the patient's shirt on. And then I'll use the bell side to assess for any other adventitious signs. And then I would do the bell side for any adventitious sounds as well. Okay, so all lung fields are clear and there were no adventitious sounds present on auscultation. Next, I'm going to do the cardiac assessment. So the first thing I'll do is reverbalize what I got during vitals. For the heart rate, which was 80 beats per minute +2 on the left radial pulse, regular rhythm, and then the blood pressure was 124/82 on the right arm. Next thing I'll do is ask them a few questions about their cardiac history. So, do you have any history of cardiac disease?
No,
Any chest pain?
no,
Any fatigue?
no,
Any shortness of breath?
no,
Do you smoke or vape?
no,
Do you drink alcohol?
no.
Do you drink caffeine?
Yes.
Okay, about how much per day?
8 ounces a day.
Okay, and then do you use any cardiac medications?
No.
Okay. The next thing I'm going to do is palpate the carotid arteries one at a time. I would palpate for 30 seconds if it was regular rhythm, a minute if it was irregular. So it's +2 regular 80 beats per minute, +2 regular 80 beats per minute. Then I'm going to assess the neck for jugular vein distension. Can you turn your head to the left and to the right? No visible jugular vein distension at this time. And then I'm going to auscultate the carotid arteries for any bruits using the bell of my stethoscope. Okay, so no bruits present on either carotid artery on auscultation. Next thing I'm going to do is observe and palpate the apical pulse, or the point of maximal impulse. So I'm going to observe to make sure it's not bounding, which it's not at this time, and then I'll palpate it for a full minute and note the rate and rhythm. So over here on the left side, so it would be +2 regular rhythm, 80 beats per minute, and then I'm going to auscultate the 5 cardiac landmarks. So I'll use the diaphragm side to do aortic, pulmonic, Erb's point, tricuspid, and mitral, all for a minute each. Then use the bell side for adventitious sounds. Again, aortic, pulmonic, Erb's point, tricuspid, mitral. So on auscultation, I heard S1 and S2 heart sounds in all 5 cardiac landmarks. And there were no adventitious sounds present in any of the cardiac landmarks. Then I'm going to palpate all the peripheral pulses at this time. So I would do this bilaterally. So I would do brachial, which is the inner fold of the elbow, +2 regular rhythm, 80 beats per minute. Radial, +2 regular rhythm, 80 beats per minute. Then I would do femoral, which is in the groin area. Popliteal behind the knee, 80 beats per minute, +2 regular rhythm. Dorsalis pedis, top of the foot, +2 80 beats per minute regular rhythm. Posterior tibialis, +2 regular rhythm, 80 beats per minute. And then on the other side as well. Then I'm going to assess the hands for any finger clubbing. So there's no finger clubbing present at this time. And then pinch each a finger on each hand for about 5 seconds to assess capillary refill. And then I would do it on each foot as well. So capillary refill was 1 second bilaterally on the hands and feet. And then the last thing I'm going to do for the cardiac assessment is palpate for any peripheral edema. So I'm gonna poke the arms, and then I would also do this on the legs as well. No pitting edema present at this time. Next system I will do is the skin. So I would have the patient remove their clothing one area at a time to fully assess the entire skin surface area. So first I'll assess for color. No cyanosis, no jaundice, no pallor, no erythema present. Then I'm gonna use the back of my hands to palpate the skin for temperature, texture, and moisture. Temperature is warm to the touch. Texture is soft, and there's no excessive moisture present. Then I'm gonna assess the entire body area for moles, no moles present, even hair distribution, no wounds, no lesions, no scars are present, and no bruising is present at this time. And then finally, I will pinch the area around the clavicle to check skin turgor. So patient has good skin turgor, the skin returned to resting position after about 1 second. Then I will perform the abdominal assessment. So I'm gonna have the patient lie down for me. So I would perform the abdominal assessment without the patient so I would have the abdominal area exposed so I can best visualize it, and I'll inspect it from 2 different angles. So one from the side, one from the foot of the bed. The contour is flat. There's no distension of the abdomen. And then I'm going to assess the color. The coloring is even throughout the abdomen. There's even hair distribution. There's no scars or lesions present, and the umbilicus is midline. Then the next thing I'll do is ask the patient a few questions about their regular bowel movement. So how often do you have a bowel movement?
Once a day.
Okay, and what's the usual character of your bowel movement?
Soft.
Okay. And any changes recently?
No.
Do you ever have any diarrhea?
No.
Any constipation?
No.
Any bloody stools?
No.
Any black tarry stools?
No.
Okay, perfect. Then I'm going to auscultate the 4 quadrants of the abdomen. I'll listen for no more than 5 minutes and begin with the right lower quadrant, and then the right upper, left upper, left lower. So all 4 quadrants displayed normal active vowel sounds. And then I'm going to use my stethoscope again and use the bell side this time to assess the abdominal aorta for any bruits. So I would listen for about a minute. There's no bruits in the abdominal aorta at this time. And then I will have the patient perform the Valsalva maneuver, so please flex your knees and then bear down for me. And then I'll observe for any abdominal or inguinal hernias. No hernias present at this time. Go ahead and relax. And then I'll palpate the 4 quadrants of the abdomen. Let me know if you feel any pain or rebound tenderness.
No.
Here.
No. No. No.
Okay, so patient reports no pain or rebound tenderness in any of the 4 quadrants. There was no distension, no excessive firmness, no guarding, and no inflammation. So I'll have you sit back up and on the edge of the bed. So then I'll perform the neurologic assessment. So can you repeat the 3 words from earlier?
Candle, backpack, orange.
Yes. Okay, so patient has remote memory intact. Immediate memory, please repeat these words in reverse order. 2, 4, 6.
4, 6, 6, 4, 2.
Yes. And then to test recent memory, what did you have for dinner last night?
Alfredo.
Okay, so patient's memory is intact, and they'll observe overall mood and affect. The overall mood and affect is pleasant, and they are cooperating in my head-to-toe assessment. Then the next thing I will do is have the patient stand for me. So first I'm going to assess the gait and also balance. So walk toe to heel in tandem for me. So patient has good balance and mobility, and then just walk back like you normally would. Patient has good gait and movement, no difficulty with ambulation and no use of mobility aids. Then I'll have the patient close their eyes and cross their arms. This is the Romberg test. So patient displays no sign of swaying. I would do this for about 30 seconds. Go ahead and relax. So the patient has good balance and proprioception. And then the next thing I'm going to do is test upper and lower extremity coordination. So can you touch your finger to your nose? And then opposite foot to opposite calf. And then I'll also do range of motion as part of musculoskeletal at this time. Raise your arms, do arm circles, sway your leg back and forth, other side. And then front to back, other side. Okay, go ahead and sit down. So patient has full range of motion in all their limbs, and they have good upper and lower extremity coordination as well. So then I will finish up the cranial nerve. So cranial nerve 8, the auditory nerve, is already intact because it's involved in hearing and balance, and they passed the whisper test and the Romberg test. And then I will also verbalize all the deep tendon reflexes at this time. So I would do them bilaterally. I would do the bicep, which is the front of the arm, tricep, back of the arm, brachioradialis, kind of near the wrist, and then Achilles, which is on the heel of the foot. And then I will actually perform the patellar deep tendon reflex bilaterally at this time. Can you scoot back a little bit for me? Okay, so there's the +2 response bilaterally of the patellar deep tendon reflex. And then lastly, I'll finish up musculoskeletal. So I'll observe the spine from the lateral view. There's no excessive hunching over, no excessive arching of the lower back. Then I'll observe it from the posterior view. There is no kyphosis or lordosis present. And then can you hunch over for me? Then I'm going to palpate the spine. Any tenderness?
No.
No tenderness of the spine and no scoliosis is present at this time. And then I'm going to test muscle strength of the limbs. So can you put your hands out, push up against my hands, and down against my hands, and then press your feet against my hands. Okay, patient has good muscle strength in all limbs. And then I'm going to palpate other joints in their extremities. Any tenderness in your shoulders?
No.
And your elbows?
No.
And your wrists?
No.
Roll them out. Any tenderness in your knees?
No.
Or ankles?
No.
Okay. Patient reports no pain or tenderness of their joints, and they're all symmetrical, and there's no crepitus present either. So that would conclude the head-to-toe assessment. Before I left, I would thank the patient for their time, perform hand hygiene, and then provide privacy before leaving the room.